Welcome to the Kevin Dunn Show. We are so excited that you've taken the time out to join us. Hope you're having a wonderful day. We have a topic, a very serious topic we're going to be discussing today on the show. Drug and alcohol addiction, a problem that plagues our society. When we come back from the commercial break, we're going to be talking with a Mr. Wayde Washburn, who is a specialist in handling drug and alcohol addiction.
At Charter Bank, you get totally free checking with online statements. You betcha. Free mobile banking, free online banking, free online bill pay, free debit card, even a new account gift. Free. At Charter Bank, we're here to wow you. And totally free checking is just the beginning. Come see us or open online at charterbank.net. Like us on Facebook, follow us on Twitter. Member FDIC, Equal Housing Lender.
We interrupt our regular scheduled programming for breaking news. We are outside of a local restaurant here where people are trying to get their way in. Miss, can you guys come here and tell us what's actually going on today?
Sure. I'm hungry. I'm trying to get in Mama Sherry's. I've been thinking about what I want all night and all day, so this is the best food in town. And so I and everyone else is trying to get in.
And what about you?
Trying to get in Mama Sherry's to get something to eat.
Well, there you have it. They're trying to get into Mama Sherry's to get something to eat. At Mama Sherry's, they want you to feel the love and warmth as they offer all of the favorite foods your mom and grandmother served you growing up. In this day and time, good food consisting of fresh meat and vegetables are hard to come by for a reasonable price. Mama Sherry's all-you-can-eat buffet has over 70 items that gives you and your family a variety where everyone will leave satisfied. They have the friendliest service on staff, just like the good old days you spent at Grandma's house. Come to Mama Sherry's, where the love and taste of great food go hand in hand. Welcome back to the Kevin Dunn Show. And how are you doing today?
I'm doing good, Kevin. How are you?
Mr. Washburn? Now explain us your job title.
Okay. I'm a National Certified Addiction Counselor. That's under the National Association for Alcohol and Drug Abuse Counselors. It's a national credential. I'm also a Certified Addiction Counselor Level 2 in the state of Georgia. The Georgia Addiction Counselors Association oversees probably most of the credentialing in Georgia for addiction counselors, and I've been credentialed with them since 1996. And also sit on the board for the Georgia Addiction Counselors Association. I have off and on for the past probably 14 years or so, and I'm currently on the board now with GACA.
Right. Very interesting. Give me your definition of the word addict or addiction.
Okay. Those are words that we hear used a lot. There are a lot of people with problems, and really what I prefer to talk about are people who have problems with alcohol and drugs. You know, whatever label we decide to give that, that's good maybe for that particular setting. But there was a guy named Father Martin. He's sort of a legend in the alcohol treatment world, and he did the old 16 millimeter shows, you know, and he talked about alcohol problems. That's primarily what he worked on. But one thing that he said that really stood out to me is that if alcohol causes a problem, it is a problem.
Right.
So, and I would say you can substitute just about anything you want to in there, whether that be if a relationship causes a problem, it is a problem. If drugs causes a problem, it is a problem. If marijuana causes a problem, it is a problem. You know, if eating green beans causes a problem, that's a problem. So, yeah.
Interesting. Now, what percentage of addiction would you say is mental, and what percentage of addiction would you say is actually physical?
You know, the actual percentages, Kevin, I probably have a hard time giving just exactly what that would be, but you hit a good point. It is a physical and a mental problem. Physical as far as maybe somebody going through withdrawals. You know, I'm on this drug and I want to get away from it, but I try stopping and I start having anything from cramps. A lot of the opiates give someone severe stomach cramps. There can be some other things such as, your body just gets used to having these chemicals in it, so there's physical dependency, and a lot of it happens in the brain, where the brain is accustomed to getting these particular chemicals inside the brain, and then you stop the flow, and all of a sudden the brain is lacking because some of those natural chemicals your brain will be producing, they've sort of been cut off a while back because you started getting it some other way, so those pipelines closed up. So you have a lot of that physical, and then the mental. We talk a lot about habits.
Okay.
Things that we're accustomed to doing. In the morning, what we do the first thing in the morning, the way we just carry out a day, the way we drive, the direction we drive to work, the way we take certain streets, the type of clothes we wear. We have a lot of habits.
Yes, sir.
So a lot of your addiction issues also come through habits. I was talking to someone recently who said that, they're used to going out. They've been used to going out and drinking, say on a Friday night.
Right.
They get off work Friday, and now it's like, oh my, what do I do now? I don't have anything to do. So what do I do? People with smoking, you see that a lot too. That you used to, like when you take a break at work, you'd rush outside and get your smoke, and then you stop smoking, and it's like, what are you doing on a break? I don't know what to do. So you have a lot of physical, chemical, a lot of those things, and percentages. I don't know, and I would more likely say it varies between person to person because we're all different. We have different body makeups. We have different things that we do. So it's probably just varies person to person.
Right. So when is it safe to say someone is addicted to drugs and alcohol opposed to just being a casual user?
Yeah. Well, there are a couple of things you might look at. One is that what I'd said earlier, if it causes a problem.
Right.
And if it meets some sort of a scientific definition of what addiction is, that may not even be the important thing.
Yes, sir.
If it causes a problem, that's probably when you need to start doing something to look at that. If using alcohol causes you to have some health problems, then you probably need to make some changes in that. If smoking marijuana gets you in trouble with the law, and you go before the court or you're on probation or something, then you most likely need to make some changes there. You may not be having other problems, but if it's causing some problems, you need to make some changes, which you need to do. Now, there's the Diagnostic and Statistics Manual, actually Volume 5, is that now the DSM-5, and it gives a more scientific definition of what substance use disorders are. And it'll give you a series like 7 different things that can happen in your life, and if you meet like 2 or 3 of these, this happens, and if it's one of these, it's this. So you have those definitions, but I'll still stick to the old thing. If alcohol causes a problem, it is a problem.
It is a problem.
And if it's a problem, you need to make some changes there.
Right. I know we just touched on the mental and the physical side, but what else? When someone is abusing drugs and alcohol, what are they really trying to satisfy?
Again, it's going to vary from person to person. For a lot of people, it's just not knowing how to cope properly. Maybe this is what they grew up seeing as a child. I remember back 20 years ago, this one guy I was working with, he told about every weekend people came to his house and they would play cards or checkers or something, but they just sat around the yard and they drank all day, and by evening everybody just passed out. That's what he knew life to be. You work all week, and then on the weekend you get drunk and you lay back. So sometimes it's just from a learned environment. Some others, it's they saw the parents or saw someone else when they had problems, maybe in the relationship or got upset. That's what they did. They turned to alcohol or a drug, some other drug, and they started abusing that. And that's just the way that they learned to handle life. For some other people, there are some mental illnesses, particularly like in depression, that I don't know how to really take care of life. I don't know how to handle the stress and all that I'm feeling. So a lot of times we call it self-medicate. Instead of going to a physician and getting the correct medication and the dosage that I need, I will take my own medication. Maybe it's out of a bottle or some pill off the street or smoking marijuana or something. So a lot of times it's that way too. Sometimes there are physical things. People may have trouble sleeping, and they find that certain drugs, help them to sleep at night. It could be particularly alcohol and marijuana. Some other people, they want to go out and have fun. Remember this one young guy a couple of years ago I was working with, and he told like he could not go to a club or anywhere and try to meet a girl until he had a few drinks down before he got to the club. So that way he'd feel comfortable and such as that. So sometimes it's just to be comfortable. There's all kinds of different things in there, but you know, usually it starts off as just a recreational use, just social use. And for some people, not everyone, but for some people, it can develop into something more.
Right. So you're saying, and I think you just said something about this a few minutes ago. So you're saying that abusing drug and alcohol can somewhat be hereditary?
It can be. Research has shown that like the son of a male who has alcohol problems is like 4 times as likely to have alcohol problems as someone who's not. It doesn't mean that they will, but it's a higher chance of that. So it is hereditary. I mean, we talked about the environmental piece.
Right,
you know, that's what I grew up seeing.
Right.
But it's also some of the genes. You know, we look at our parents and see. You know, I know some of the medical issues that I have. I say, okay, yeah, that came from my mother.
Mama,
this came from my dad.
Right.
Well, you know, same thing with alcohol and drug problems. We can pick that up from parents or grandparents. It can skip a generation. A lot of times you'll see, you know, maybe that somewhere in the family history there's some major alcohol and drug problems, and then you see it landing again here. So it can be hereditary. Sort of like allergies.
Allergies.
A long time ago I heard someone talk about strawberries. Say, you don't necessarily know that you're allergic to strawberries until you eat strawberries. You know?
Right.
So maybe you go all your
Right.
life, don't eat strawberries, and you eat strawberries, wow, I'm allergic to it. Same with alcohol or some other drugs. You may not know that you really have problems with that until you start using it. And then you may use it a little bit more, and then the things kind of kick in and it starts affecting your life.
Now, in your line of work, research, what would you say problem is more common, the alcohol abuse or the drug abuse? I know it's
I won't even pause on that one. Alcohol.
Alcohol.
And actually, a lot of this is probably because, well, alcohol is legal, so it's more widespread. You can drive down the road, you can hardly go 2 or 3 miles without being able to stop somewhere and buy some.
That's true.
You can buy illegal drugs, but you normally don't see your signs hanging out front. You know, marijuana for sale here. You may
some states
get it there. That's right. There are some. Yeah. The marijuana doctor is in. I've seen those signs. But alcohol generally causes most. But that's part of it, just because it's more widespread. It's more available. But it is abused more than other drugs are. Now, below that, and you get into your illicit drugs, marijuana tops right up there. Of course, there's a lot of debate throughout the nation now, throughout the world really, about the marijuana and marijuana use. You know, I don't know what the answer to that is. Marijuana causes problems. It really does. And research shows that it causes problems as far as particularly in memory. Sometimes you find students that want to smoke weed so that they can study and concentrate on a test, but it really blocks some memory things. It really interferes with that. So that even though it may relax you and allow you to study, it can do have some memory problems. And occasionally I'll see someone who's been smoking a lot of marijuana and they say, man, I just can't remember anything. And okay, yeah, we know where that comes from. So marijuana, even though, I mean, it has some problems. I mean, alcohol has a lot of problems too. So we can't just say because it has problems, we can't allow that. So, you know, that debate continues. But anyway, yeah, alcohol, that's going to be by far the most problems you're going to see. Alcohol, you're going to have a lot of violent crimes, things like that. Marijuana, you rarely see violent crimes from marijuana. So again, that's part of the debate. But then marijuana, like I said, marijuana is the next one. Something you find, and I don't know how the percentages, but prescription abuse. That's a big one these days.
That's definitely growing.
And it's hard to find. You know, if you go to your physician, and of course physicians are different the way they do things, but some people go to the physician and say, I'm having this issue right here. You know, they maybe get prescribed a certain narcotic. Sometimes that person may go back to the doctor and say, look, I really needed that a lot more for my pain, so I need some more. And they may get that again. Now, some physicians won't do that, so it varies there. But it certainly lends itself to abuse. For a long time with more of like maybe an elderly population, prescription abuse has been there, but it's not necessarily noticed. You know, I go to work every day. You go to work. You know, we get out in the community. But sometimes people elderly may not get out much. I know before my mother passed away years ago, you know, she may not leave the house all week except to go to church.
So wait, hold that thought just for a second. We're going to have to pause and take a quick commercial break. We're going to come right back to that answer that you were given. More of Mr. Washburn when we come back on the Kevin Dunn Show. What are you doing for lunch today?
Man, I don't know. I was thinking about some wings.
Well, I know where we are going. DJ's. DJ's has bone-in wings, hot or mild, lemon pepper, barbecue, and you gotta try the sweet and spicy.
And DJ's also has boneless wings.
They've got delicious fish and steak sandwiches.
And their salads are big enough to even fill me up.
And top it off with a fruit and ice frozen drink.
Man, I'm hungry.
We're headed to DJ's.
Life in the country is a conscious choice. And with that choice comes hard work, attention to detail, and investing in the right tools to keep your home or farm at its best. So why choose anything but the very best zero turns on the market today? Exmark. Known for their durability, precision cut, and time-saving performance, Exmarks are the preferred brand of mowing equipment for the landscape professional and people like you who take pride in their lawn. For special pricing incentives, visit exmark.com or your local dealer.
Welcome back to the Kevin Dunn Show, where we were talking about the addiction of alcohol and drug abuse. You were sharing right before we went to the commercial break, which was next on my list to ask you about prescription drugs, and you were sharing about the elderly. Can you continue that thought, please?
Yeah, I was saying that sometimes, a lot of times this is an elderly population that gets into this, and they get the drugs, and sometimes after a while the body changes and things start backing up, maybe as far as what you have in your system. Anyway, you may start abusing some drugs like that, not intentionally abusing as far as I'm trying to get high. Right. But you just start taking it, feel like you need this to get along. But people may not see that. May not be seen but once a week, and so you don't really know. A few years ago, I was on a survey, accreditation survey that I do, and there was a guy who, someone on the survey reported that felt like he was drinking too much. So the organization called me and asked me what I thought, and I said, well, I don't know. They said, well, did you see that he was impaired? Right. I said, I don't know the person. I don't know how he normally acts. A lot of us act impaired all the time. We're not necessarily impaired. So I don't know what was normal for him. But in prescription abuse, sometimes it gets to be where it becomes so natural that people around you may not even notice that you're impaired. That's because that's just how they know you, and that's what you're doing. So if you stop taking the pill, then they think something's wrong with you, because now you're not energetic, you're not outgoing, you're not the nice, kind, friendly, outgoing person that you once were. So it's tough to pick up the prescription abuse sometimes. Now, in your line of work, and I don't know what the studies say about this, who would you say struggle with addiction more, men or women, as a whole? It's difficult to say. Generally, women tend to come and, like, for volunteer services, they generally come in through the mental health system. I'm feeling depressed, I'm feeling down, I just can't function. It's in that area. Men, we often come in through different problems that come up. It may be a legal issue or a health issue that comes in. So it's going to vary a lot. From what I see, and my program here, Addiction Recovery Services in LaGrange, we primarily deal, it's mostly, I guess, through the legal system. Not everyone, but most of it's through the legal system. And by there, it's for, I have mostly males. Of course, I'm male, so that may be part of it. That the males come to me, and as a female, they may come to them more. So that can vary again, from consumer choice, what they would do. So I can't really say that. Okay. But usually, I think you would probably see the males entering more through services. Interesting. Outside of prescription drugs and marijuana, what are 3 other drugs that you see that are abused the most? Well, of course, we hear a lot about methamphetamines, the meth, and you see a lot of legal issues about meth labs and things like that. Meth is such a dangerous drug. I remember someone telling me a year or so ago that when one time they tried some meth, and when they tried it, it hit them so hard that they knew then that they better not ever try that again, because they were gone. And they worked really hard to get away, and they did it that one time, that's all they did. But they said they knew what happens to these drugs. It hits a part of the brain called the pleasure center, and that's a more scientific name, but the pleasure center. and it's like it hits that pleasure center, and it's such a great feeling to you that nothing else compares. I mean, you've seen the studies, you know, the rat taking the cocaine, you know, and the cocaine hits the pleasure center of that rat's brain, and actually, you know, they've done studies where they actually inject that into that part of the brain. Well, no longer is food important, or sex important, or sleep important, and that's what it is with humans. You know, when it hits that pleasure center, it can be so great that nothing else compares. So we just keep seeking that same pleasure. So meth is one of those things that really hits that pleasure center hard, and it's just so tough to turn around from. Because you have that, you have cocaine, that's a big one. So I know we're talking about the alcohol, marijuana, your prescription pills, your meth, cocaine. I mean, that's primarily what you're going to see. Heroin, it's out there in some areas. It sort of makes them come back, and occasionally I'll see someone who does some heroin. Whenever an opiate hits the brain, it's just like heroin, because that's what it is. Heroin is an opiate. Oxycodone, Percocet, Vicodin, those medications, those are opiates as well. And when they get to the brain, it's just like heroin that's hit the brain. So it's there. So that's what you're feeling, is that rush from the heroin. So it's a really tough thing to deal with.
Wow. And we were talking backstage. We hear about different programs, different options, and you shared with me something back there that I never really thought about, that there's a treatment process to help someone who have these problems. So explain to us about the treatment that could help someone who may be addicted to drugs and alcohol.
Yeah. Treatment is primarily looking at some sort of evidence-based research that to show, okay, this works. And that's really important. If something's not working, we don't need to keep trying that one if it's not working. But treatment is using evidence-based research and trying to make changes in someone, trying to help that person make changes. A lot of times when we think of treatment, we think about going to a doctor, we think about getting a shot, we think about getting a surgery. It's those kinds of things. In the addiction field and in the mental health field, it's not quite as concrete as that. You know, even though there's some medications and some injections that can help with some of these things. In the addiction world, a lot of it's what we call talk therapy. Now, as far as treatment, you know, back in the, I'd say late 80s and maybe early 90s, we heard a lot about 28-day program. In fact, there was a movie, Sandra Bullock, 28 Days.
28 Days, yeah.
That's one of those infamous movies out there in the treatment world, 28 Days. There was nothing magical about 28 days, except insurance would pay up to 28 days.
Gotcha.
And somewhere in our brains kind of hit us, well, if you need treatment, you need to do 28 days, and that's where it is. Well, in the mid-90s or so, insurance started backing down and some things changed, so all of a sudden your 28-day programs weren't quite so plentiful. That for a while it was like maybe 2 weeks, so 14 days. Now a lot of times your insurance will pay maybe 7 days, maybe for a detox. It's to getting the poisons out of the system. But then from there you go into a different level.
Right.
Now, if I go to the doctor and say, you know, I'm having a pain right here, most likely, hopefully, that doctor's not going to say, well, let's go and take some things out and see how that works. So, you know, there are different levels of treatment. They might say, well, let's watch a diet and see what that does.
Right.
Or have you done something to strain, let's not use this arm for a while and see if we can do that. Same in the treatment world. Sometimes you may need that residential program. It could be 90 days, it could be a year, it could be 28 days, it could be 2 weeks, it could be a detox, some sort of a residential or inpatient treatment. At other times you may not need that. It may be more of an outpatient. I mean, how many times we go to the doctor and we end up just going back, monitoring maybe a diet or exercise, maybe on some medication. That's an outpatient treatment. You don't go in the hospital every time you have some illness.
Right.
Well, there's a thing out there called the American Society of Addiction Medicine, professional organization. They have this schedule called ASAM levels, and ASAM levels are different levels of treatment. ASAM level 0.5 is education, your DUI skill. That's a good example of ASAM 0.5. It's not really a lot of interaction. It's more of just, here's the knowledge, I'm sharing this with you, you have some education, and that's it, ASAM 0.5. ASAM 1.0 is actually from 1 to 9 hours a week. 1 to 9 hours a week of treatment, yeah. That's ASAM 1.0. Now you may have 1 hour For instance, in the state of Georgia, the DUI treatment program requires it to be at least 3 hours a week, but it's all within that ASAM 1.0 level, 1 to 9 hours. Well, you have ASAM 2.1, which is, we generally call it intensive outpatient, and that's where you come from 9 hours up to 20 hours a week.
Right.
Maybe 3 hours a week, 3 nights a week for 3 hours each night. And then also you have your partial hospitalizations, and that's sort of what the old 28-day program sort of got bumped down to the partial hospitalization in a lot of cases. That may be where somebody comes for 4 or 5 days a week, and they come in for 3, 4, 5 hours a day, but it's like over 20 hours a week.
Over 20 hours a week.
And then you get more into your 3.7 would be your detox, where you have like a medical detox, and you have physician, nursing, monitoring, and prescribing medications for you as well. So it's many different levels, and it depends on where you are, what's going on. There are several different dimensions that are looked at to determine which level you need. Anything from maybe the family support that you get, or friends around you that are supportive of you, your living environment, your relapse potential. Have I tried to stop before? Yeah, I tried a bunch of times. I always started right back. So relapse potential. Can do with medical. Are you having some medical problems right now, and the alcohol or the drug is affecting that? So you look at that. It's like 7 different dimensions you look at, trying to determine which level someone needs to go in.
Wow, so huge problem, and it's also huge to diagnose the problem too, to treat it, and because there's several different entities that that are involved. One thing I've found out, that people who are struggling with drug and alcohol addiction, when they're trying to wean themselves away, they smoke cigarettes a lot. Is that really helping, or is it hurting, or?
Gosh, Kevin, I don't know.
Okay.
it's again, you do away with this,
right,
and you might start with this. And cigarette has nicotine. It is a drug. It really is. And we're starting to look at that much more seriously. So it's back 10 years ago, the state of Arkansas said that use of tobacco is not allowed on any on the grounds of any medical facility. That was Arkansas 10 years ago. And that meant alcohol drug places, that meant mental health programs, of course your hospitals and doctors' offices as well. So we're looking at that much more seriously, and of course most of your medical places now do say that no smoking in that area. Someone trying to get off of one thing often substitutes something else. I remember someone telling me years ago, this is back when crack cocaine was like the big drug out there.
Right.
Someone told me that, well, they didn't have a problem stopping because they stopped marijuana all on their own. I said, well, when did you do that? About 2 years ago. So what did you do that? Well, start doing crack then. So sometimes you might substitute a more dangerous drug. Now, I wouldn't say cigarettes a more dangerous drug.
Right.
I say it's less of the evils of some of these others, but still something we need to pay attention to and work with.
All right. Well, Mr. Washburn, we thank you so much for being a guest on the Kevin Dunn Show.
Thank you for having me on, Kevin.
I know our listeners have been inspired and have been educated, and wish you much success in treating drug and alcohol addiction. I think it's very commendable, what you do, trying to help assist. Thank you so much for watching the Kevin Dunn Show. And remember, if there's a topic you would like to see discussed, please email us at thekevindunshow@wjcntv.com. Thanks for watching, and have a wonderful day.